Good afternoon, everyone. Thank you so much for joining our webinar today. And we are pleased to be hosting a webinar, Aging in Place, Actions to Promote Healthy Aging in Communities. And we are so pleased to be joined today with Natalie Iciaszczyk, and she is a Policy Analyst with the National Institute on Aging. I do have a few small housekeeping items, which I'll talk about after we do our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Just a few items to remind people, we are pleased to have our ASL interpreters with us today. At the top of your screen where there's a grid, you can put your presentation into gallery view to see that. We have spotlighted both ASL interpreters today, so you can choose how you'd like to see the presentation throughout the session, and you can change that as you go if you'd like. As I mentioned, I do have closed captions enabled. Again, you can turn that, enable or disable that on your own screen. And if you choose to have the images of the speakers larger, you can drag the PowerPoint a little bit over to the side to make the images larger for the presenters, to make the PowerPoint presentation smaller for your visual looking at the presentation. So just as a reminder, we have a chat box, which we totally encourage everyone to post comments during the session. I will be putting in links during the presentation for people to access information that Natalie refers to. If you have a specific question along the way, please put that in the Q&A box at the bottom. We don't want to miss your questions. So if you do put your question in the chat box accidentally, I will probably ask you just to push that into the question box so we don't miss it. We know during the session, many people have lots of comments, so it's difficult sometimes at the end to find questions if we miss them in the chat box. So just as a reminder, because everyone's questions are so important, and we'll do that at the end of the session. As you know, everyone's muted to the webinar because we have so many people online, just to make the background quiet for the presenter to speak. We are recording the presentation and it will be available on our website, hopefully by tomorrow, where we get it uploaded along with the PowerPoint presentation. So I know people asked that during the session, so just be reminded that is recorded and it will be posted, the PowerPoint presentation, and any links that are shared will also be posted on our website. You will also get an email reminder about where to find this information after the session. And finally, we do have an evaluation. It's 7 quick questions. We do appreciate your feedback. Again, just to give us ideas of suggestions for future topics and how you found the session today in terms of increasing your knowledge and information to assist you further. And lastly, if you have any personal circumstances or questions that are specific, we just ask that you maintain keeping questions general, because this is a public forum. And if you'd like to reach out to myself or our organization, please do so by phone or email. We've been more than happy to assist you in that capacity. For those who are just joining us for the first time, just a quick overview about our organization. Our mission is to make sure that seniors feel strong, have a strong voice, feel respected and treated with dignity across Ontario and beyond borders, obviously. We do that through raising awareness, delivering public education, such as our training and education session today. And we work with many, many organizations, both within Ontario and across Canada and nationally and internationally, to look at combating elder abuse and preventing this from happening. We are mandated to implement Ontario's strategy to combat elder abuse and funded for that strategy under the Ministry for Seniors and Accessibility. That strategy has 3 main pillars, which are education and public awareness, training of frontline staff, and working with community services. And as you can imagine, there are many, many activities that we are involved in under each of those pillars. And what's coming up is World Elder Abuse Awareness Day under public education. So you'll be hearing more about that we're in the coming months. We also have right now a survey out for World Elder Abuse Awareness Day as part of that campaign under awareness to get your feedback on what you'd like to see for speakers and topics for that session coming up on June 15th. So it gives me great pleasure to introduce Natalie. Natalie is a policy analyst at the National Institute on Aging, a public policy and research center based at the Toronto Metropolitan University, formerly known as Ryerson University. And she's focused on the realities of Canada's aging population. She holds a master's in sociology and law degree from Western University and is passionate about using her research background and training to help shape policy in response to Canada's aging population. We are so pleased that we are able to learn more about the report that was just recently completed by NIA, and Natalie will walk us through some of the key points and try to answer any of the questions that people have today. Natalie?
Thank you very much. So I will just share my screen to get my slides up. Okay, so thank you very much for that warm introduction. And so yes, today we're going to be covering a recent report that the NIA launched titled About Aging in the Right Place. And this is really the first report that we launched in an overall series about aging in the right place. So before I kick things off, I'm going to cover some background and context about why the topic of aging in the right place has become such an important topic of focus and what led the NIA to launch its research series on the issue. So today, Canada's population looks very different than it did 4 decades ago when the Canada Health Act was implemented. Yet its health and healthcare and support systems haven't really changed. And this means that they haven't kept up with the evolving needs of an aging population. So older adults have very different health and social care needs than younger people, and that they have a greater demand for services overall because of declining health, but also tend to be living with multiple chronic diseases or disabilities as opposed to acute illnesses for which our system was predominantly designed. And this means that building the capacity to care for an aging population will require that we expand the availability of key existing services, such as long-term care, but also that we transform the way in which we provide that care. And in addition to having a system that is currently not set up to adequately care for a growing number of older Canadians, a second key part of this story are the actual preferences of Canadians about where they want to receive care and live out their remaining years as they age. So we know that as they get older, Canadians overwhelmingly want to remain in their own homes and communities rather than move into long-term care homes, whether that be what we commonly know as nursing homes or even retirement homes. And the COVID-19 pandemic has really played a big role in strengthening those feelings among Canadians. So early on in the pandemic, the NIA examined survey data looking into Canadians' perceptions about aging in Canada in light of the pandemic, and they found that around 60% of Canadians said that the COVID-19 pandemic had changed their views on whether they would go live in a long-term care or retirement home, or whether they would arrange to have a loved one live there. The overwhelming majority of Canadians also said that they plan to support themselves for as long as possible to remain in their own homes, with 91% of Canadians of all ages saying that was their plan, and the share being nearly 100% among those aged 65 years and older. Findings from another survey the NIA analyzed a few months later in the pandemic found that Canadians not only prefer to be in their homes, but now also explicitly want to avoid moving into long-term care homes. So 85% of Canadians of all ages and 96% of those aged 65 years and older said that as they got older, they would do everything they could to avoid moving into a long-term care home. And more recently, the NIA launched its first annual survey on aging in Canada. And the findings from that made it very clear that remaining at home and in their communities is the clear preference of Canadians. So now, outside of the context of COVID-19, when Canadians aged 50 years and older were asked where they would like to live as they age, among those who were still living in their own homes, 71% said they wanted to stay there, and another 14% said that they would want to do the same thing, but just downsize to a smaller home. But not only do Canadians want to age and get care in their own homes over institutional facilities, but giving them the option to do so also costs the government a lot less than providing care in long-term care homes. So home and community-based care, which is care provided in home-based settings rather than in hospitals or long-term care homes, has been shown to be far more cost-effective than providing equivalent care in hospitals and other institutional settings, such as long-term care homes. So for example, studies have found that home care services are around 40 to 75% less costly than providing the same care in a long-term care home. Similarly, the NIA's report on bringing long-term care home found that the Ontario government could save an average of approximately $240,000 in infrastructure costs for every long-term care bed it would no longer need to build or redevelop by better meeting the needs of its aging population at home. Yet, despite the fact that it costs less, Canada's long-term care system has traditionally focused on care in institutions rather than home and community-based care. So the OECD's most recently available estimates revealed that in 2019, 64% of Canada's long-term care expenses or expenditures were allocated to institutional care in nursing or long-term care homes. Although this was an improvement since 2017, when the OECD reported that 87% of Canada's long-term care spending was allocated to institutional care and only 13% to home and community-based care, Canada still spends a greater share on institutional care than the average among OECD countries, with the average country spending about 52% of its long-term care spending on institutional care and the other half on home and community-based care. But the countries that have shifted more of their budgets towards home and community-based care have seen how it can help address the care needs of an aging population in a more fiscally sustainable way. So for example, Denmark began shifting its spending to more home and community-based care over 30 years ago when it was facing demographic and fiscal challenges similar to Canada's. So they focused on providing more home-based long-term care services and developing more supportive housing and assisted living supports to allow more people to age in their own homes and communities for longer. And within 10 years of implementing this approach, Denmark was able to reduce long-term care spending for its population aged 80 and over by 12%. This means that shifting how we provide long-term care to provide more of it in the home and community would offer Canada a solution to the growing problem of capacity it is facing as its population continues to age. The reality is that today, Canada's long-term care systems are already strained and not equipped to handle the growing number of adults in the country, of older adults in the country. When we think about the number of Canadians receiving long-term care today, only a small proportion of older adults receive any long-term care services at all. So based on the most recent census data, an estimated 205,000 Canadians aged 65 and older were receiving care in long-term care homes in 2021, equivalent to only about 3% of the population aged 65 years and older. Yet the country is facing a huge problem of unmet need, with an estimated 52,000 Canadians on waiting lists for a placement into a long-term care home in 2021. In addition, more than 430,000 Canadian adults were estimated to have unmet home care needs, with about 167,000 of them being aged 65 years and older. So despite the fact that only a small share of older Canadians rely on long-term care services, Canada is already struggling to provide care to those who need it and struggling to meet demand when it comes to care in both institutional settings as well as home-based settings. So this is only going to increasingly become a problem as the number of older adults requiring long-term care services continues to grow in Canada. Currently, Canadians aged 65 years and older make up about 1 in 5 Canadians, but between 2016 and 2021, the number of people aged 65 and older rose about 18%. And since 2001, the number of people aged 85 and older has doubled, and this number could triple by as soon as 2046. So as the number of older adults continues to rise in the coming years, Canada will need to find ways to meet the growing demand for the provision of long-term care services while also sustaining the related public health care costs. But in addition to struggling to meet the growing demand for long-term care services, the current approach that is being taken in Canada is also resulting in a large number of older adults ending up in long-term care homes who don't necessarily need that level of care. So not all adults with complex care needs require care in long-term care homes, but many end up there because of a lack of available home and community care. So recent estimates suggest that between 11 and 30% of older adults admitted to long-term care homes across Canada could potentially have remained at home and in their communities if adequate home care and community supports had been made available. So the current approach is one that is inefficient and that has led to inappropriate and costly utilizations of our resources. So overall, we have this problem where many older Canadians are not able to get long-term care services they need, and demand for those services will only continue to grow in the coming years. But we also have older Canadians who don't need long-term care homes ending up there due to a lack of better alternative care options. And then that's costing the government at a time where it is crucial that they begin finding sustainable approaches to funding the growing demand for publicly funded long-term care services. And all of this is happening in the context of Canadians wanting to remain and age in their own homes and communities. So it is clear that there is an urgent need to redesign our current system of long-term care, and that is where the NIA's approach to aging in the right place comes in. And so recognizing that we need to start coming up with adequate solutions, at the NIA, we wanted to focus on how we can better enable more older Canadians to age in their homes and communities for as long as possible, or what is commonly known as the concept of aging in place, as this option both aligns with the preferences of Canadians and could help Canada's already strained long-term care systems better meet the needs of its aging population, and therefore promote a more fiscally sustainable future for all Canadians. And the overall idea of aging in place and its importance has been gaining attention among researchers and governments in recent years. So for example, Canada's government announced in 2021 that it was planning to support more aging in place initiatives and pledged 90 million over 3 years for a new Age Well at Home initiative to assist community-based organizations in providing support to older adults. More recently, the Liberal government also pledged to create a committee to offer recommendations for establishing a new aging at home benefit. But while these are important first steps, more concrete action is needed in the coming years to start implementing policies and approaches that can really effectively support older adults' ability to age in place. So with that in mind, at the NIA, we wanted to delve into this topic and the practical approaches that could be taken to make this a reality for Canadians. And so that was really what motivated us to put together a report on the topic of aging in place and what is required to make it happen in Canada. But also recognizing that effectively supporting older adults to age in their communities for as long as possible will require responsive systems and services. The NIA focused specifically on what it calls aging in the right place rather than just aging in place. So while aging in place has become an increasingly popular topic, we wanted to consider the topic while recognizing that older adults have different preferences, needs, and even norms and expectations around where they want to age, and that the older population can't be grouped under one single umbrella. And so we wanted to examine the issue from a standpoint that left room for these variations, and out of that was born the concept of aging in the right place. And so we define aging in the right place as the process of enabling healthy aging in the most appropriate setting based on an older person's personal preferences, circumstances, and care needs. And so in our report, we set out to present a practical framework on aging in the right place that would highlight key areas and factors that are essential to supporting older adults who want to remain in their own homes and communities for as long as possible, and reducing unnecessary long-term care home admissions. So based on our definition, the NIA identified 4 key pillars fundamental to enabling aging in the right place in Canada, with these 4 pillars being promoting preventative health and better chronic disease management, strengthening home and community-based care and supports for unpaid caregivers, developing more accessible and safer living environments, and improving social connections to reduce loneliness and social isolation. So these distinct, interconnected pillars provide a comprehensive framework of what we have deemed to be some of the most important factors to enable older adults to age in the right place. The goal of us outlining this framework in our report was really to identify what is required to make aging in the right place work and how we can effectively do that in Canada. For each of these pillars, we cover evidence that shows why these factors are so important when it comes to aging in place, and existing best practices and opportunities that can reduce unnecessary long-term care home admissions and support policies and programs that promote aging in the right place at the individual, local, regional, and federal level in Canada, as well as beyond. Our framework also recognizes that aging in the right place occurs in the context of a broad range of social, economic, political, and environmental factors, and that none of the identified pillars exist in isolation. And so now I'm going to walk you all through the NIA's framework of the 4 pillars, why they each play such a critical role in enabling aging in the right place, and some of the best practices and opportunities related to each of them that can help better support older Canadians to age in their own homes. And so the first key pillar is about how we can best support older adults to maintain good health as they get older by promoting preventative health and better chronic disease management, given that nearly all long-term care home admissions are attributable to declining health, well-being, or a loss of physical or cognitive function. So in researching our pillars, the NIA looked at existing research on the key predictors of long-term care home admissions when it came to the factors related to physical health among older adults. And while there were a number of factors that were responsible for sending older adults into long-term care homes, there were 4 areas that really stood out as being especially significant in predicting whether older Canadians will need to transition into institutional care settings. And so based on these, we focused on 4 specific intervention areas to improve wellness, preventative health, and chronic disease management across Canada, with the aim of reducing future long-term care admissions. So these 4 areas were chronic disease prevention and management, dementia prevention and support, preventing falls and promoting safety, supporting people's activities of daily living. So as I mentioned back at the beginning, it's very common for older adults to be living with 1 or more chronic conditions. In fact, current estimates suggest that about 1/3 of community dwelling older Canadians have multimorbidity, which is the co-occurrence of 2 or more chronic conditions. When looking at the entire older adult population, about 40% of adults aged 65 years and older have multimorbidity, and the share is almost half among those aged 85 years and older. And the presence of multiple chronic conditions translates into health service utilization, costs, and long-term care home admissions. It is estimated that nationally, chronic conditions and other illnesses cost $68 billion every year in direct healthcare costs. Among adults aged 65 years and older, those with 3 or more chronic conditions have almost 3 times as many healthcare visits as those with no chronic diseases. In addition, while only 1/4 of older Canadians have 3 or more chronic diseases, they account for roughly 40% of healthcare use among older Canadians. And research has demonstrated that as the number of chronic diseases increase, so too does the likelihood of being admitted into a long-term care home. So these numbers really highlight how managing multimorbidity will be a big challenge in the context of aging in the right place, as the number of older adults living with multiple chronic conditions only continues to rise in the future. So this brings us to what are possible initiatives that can help older adults living in the community better manage their chronic diseases and avoid long-term care homes. One option includes comprehensive geriatric assessments, where individuals are then referred to other needed services and which have been found to significantly reduce long-term care home admissions among older adults. Similarly, programs to improve medication management using both health educators and calendar cards have been found to be effective in preventing admissions into long-term care homes. Remote patient monitoring programs have also shown great promise in improving chronic disease management in community settings. Finally, some care models such as community paramedicine programs, in which trained paramedics work with healthcare professionals to reduce hospital visits and improve quality of life, have also shown promise in reducing hospitalizations and resulting long-term care home admissions. And now moving on to the second intervention area related to our first pillar, which is dementia prevention and support. So dementia is also a chronic health condition, but one that warrants specific attention due to its high prevalence among older adults and the unique consequences it poses for one's overall health and ability to live independently in later life. So dementia is not a specific disease, but rather a general term for diseases or conditions that can deteriorate cognitive function, such as memory, thinking, and decision-making, and interfere with a person's ability to perform everyday activities and live independently. The deterioration in cognitive function caused by dementia goes beyond what might be expected from normal aging. And if left undetected and untreated, it can adversely affect one's overall quality of life and care. And Alzheimer's disease is one of the most common forms of dementia. So dementia is perhaps the greatest predictor of long-term care home admissions, and it is estimated that close to 70% of long-term care home residents are living with a diagnosis of dementia. So given the role that dementia plays in leading older adults to enter long-term care homes, and both the current burden of dementia and the projected increase in the number of older Canadians that will be living with dementia in the future, finding ways to better prevent dementia and support those living with dementia is also crucial to enabling older adults who want to remain in the communities be able to do so. So in 2020, there was an estimated 600,000 Canadians living with a diagnosis of dementia, of whom about 570,000 were aged 65 years and older. But due to population aging, the incidence of dementia in Canada is only going to continue rising. And the Alzheimer's Society of Canada projects that by 2030, nearly 1 million Canadians will be living with dementia, a 65% increase from 2020. And by 2050, the number of Canadians living with dementia will almost triple to 1.7 million. And so when thinking about initiatives that can target dementia, one type is dementia risk factor modification. So implementing preventative measures that target key risk factors for dementia early enough in life to prevent or delay the onset of the condition can be very effective, with one review suggesting that as much as 40% of dementia cases could be prevented or delayed if preventative measures targeting 12 key risk factors of dementia were pursued. So these risk factors for dementia can include things such as depression, social isolation, and physical inactivity. And the review actually found that tackling these three risk factors alone could reduce the occurrence of dementia by about 9%. Another type of intervention is community care coordination, which involves assessing individuals with dementia, referring them to services, and providing information and supports as needed. And a number of studies have found that community care coordination can also be effective in reducing long-term care home admissions when it comes to dementia. In addition to dementia, another huge contributor to long-term care home admissions among older adults are falls. So preventing falls and promoting safety is the third intervention area under the first pillar of our framework due to the significant burden of falls and their resulting consequences in Canada every year. So according to the World Health Organization, about a third of older adults fall each year, and older adults are more likely to fall as they age. And once they have fallen once, their risk of falling again doubles. So falls have huge consequences in Canada and are the leading cause of injury-related hospitalizations and deaths among Canadians aged 65 years and older. And as the population has been aging, the number of annual falls has been increasing. Falls have been driving more hospitalizations among Canada's older population, and deaths from falls have also been rising. So falls are a strong catalyst for transitions into long-term care homes among older Canadians and are actually the primary type of injury responsible for leading them into long-term care homes. So existing research from the Canadian Institute for Health Information suggests that as many as 23% of long-term care home admissions in Canada are attributable to falls. Falls are also one of the main causes of hip fractures, responsible for about 95% of them, which are themselves a huge predictor of long-term care home admissions. And so preventing falls is so critical because it can not only reduce the overall number of long-term care home admissions that come from falls themselves, but also reduce admissions from the various consequences that stem from falling and that also contribute to sending older adults into long-term care homes, such as hospitalizations, loss of physical functioning, and increased isolation. So when thinking about how we can better enable older Canadians to age safely in the right place by limiting their risk of falling and fall-related injuries, one of the simplest things people can do are behavioral and environmental changes to protect themselves against falls. So behavioral changes include things like moderating alcohol consumption, getting appropriate physical exercise, and not smoking, while important environmental changes include home modifications that reduce fall hazards, such as lighting, handrails, and surfaces that prevent slips. Another type of intervention that has become increasingly popular are digital and technological solutions that help older adults more safely remain in their homes, such as personal emergency response systems that automatically detect falls and summon help. And finally, activities of daily living are the last area of focus under our first pillar related to promoting preventative health and better chronic disease management. So activities of daily living, which are commonly referred to as ADLs, are essential and routine tasks that relate to a person's ability to care for themselves and that reflect their functional abilities, such as personal care, cooking, cleaning, and transportation. So when older adults are unable to accomplish ADLs independently, whether that be due to frailty, disability, or some other health condition, this can lead to unsafe conditions and a poorer overall quality of life. Canadian research shows that older adults who have inadequate access to supports and helping them manage their ADLs are more likely to be institutionalized and ultimately end up requiring more healthcare resources. So because Canadians today are living longer than ever before, a larger portion of their later years will be spent living with disabilities, requiring them to manage their ADLs. And this means that the ability to age in the right place will also increasingly depend on the availability of interventions that promote accessibility or that improve accessibility and support those living with a disability. And so now I'm going to be moving on to the second pillar of the NIA's Aging in the Right Place framework, which focuses specifically on strengthening home and community-based care and supports for unpaid caregivers. So this pillar really breaks down into two intervention areas that can help reduce long-term care home admissions among older Canadians. The first is improving the provision of home and community-based care, which includes both home care services and home support services. So home care services focus more specifically on healthcare and medical needs and include a wide range of services such as palliative care, therapy and rehabilitation, and nursing care, which are often, but not always, provided by licensed healthcare professionals. Home support services, on the other hand, focus more on helping older adults with their ADLs and functioning. So they tend to include non-medical services related to personal care, housekeeping, and preparing meals. And so home care and home support services are also then supplemented by community-based support services such as adult day programs, meal services, home maintenance, and companionship and recreational programs that help older adults engage with their social and physical environments. So as discussed at the beginning, overall, Canada currently does not prioritize providing older adults with long-term care within their homes and communities, and instead focuses largely on institutionalized long-term care. And as the number of older adults has increased across levels of government, the response to date has largely focused on expanding the provision of institutionalized care. Not only has this made it more expensive to provide publicly funded long-term care to Canada's aging population, but it has also resulted in significant gaps and shortages in the types of care that better meet the needs of our growing number of older adults. So this is really why, as Canada's population continues to age, one way to address these shortages and support the ability of Canadians to age in the right place is to improve the provision of home and community-based care. And the second part of this pillar focuses on interventions that support unpaid caregivers, given the critical role that they play in supporting older Canadians to age in their own homes and ensuring the overall sustainability of the healthcare system. So family and friends are the greatest source of ongoing support and care for older people in Canada. And NIA estimates suggest that as much as 75% of home care supports currently being received by older Canadians are being provided for free by their family members. So unpaid caregivers are also critical to supporting the ability of older Canadians to age in place because they supplement the limited care that is currently available through publicly funded home and community care systems. And therefore, they are the ones who make it possible for older adults to have alternatives to costly facility-based care. So really, both home and community-based care and unpaid caregivers are absolutely essential pieces of this system, and making aging in the right place possible and finding ways to strengthen and support these systems of care is critical to the future in Canada, and that's why they make up this second pillar in our framework. So when thinking about the issue of how we can improve the provision of home and community-based care, it's really first about expanding its availability across Canada. So if older Canadians had reliable home and community-based care to rely on, this would really improve the quality of care they receive, while also having significant economic advantages for the country. But the current prevailing policy focus on institutionalized care has led to inappropriate and costly utilizations of resources. So, for example, on any given day, there are thousands of Canadians occupying hospital beds as they wait for home care services to become available. And a recent analysis showed that about 20% of Canada's long-term care expenditures are spent on housing people in publicly funded hospitals, owing largely due to a lack of capacity to support these individuals with long-term care services in their own homes or in long-term care homes. And so the limited availability of appropriate long-term care in the right settings translates into huge costs. One Canadian study notes that the cost associated with Canadians receiving long-term care services in publicly funded hospitals is at least $2.3 billion every year. And because home and community-based care costs less than equivalent care in hospitals and other institutional settings, reorienting healthcare delivery towards more home and community-based care could reduce the costs that stem from the unnecessary and expensive facility-based care many individuals are currently receiving. So home and community-based care programs can target the specific needs of older adults, including things such as chronic disease management, dementia care, and supports for activities of daily living. And so when thinking about shifting resources away from institutional long-term care towards more home and community-based care, there are a number of initiatives and evidence-based alternative models of care that could be integrated into Canada's current long-term care system to improve both the availability and quality of home and community-based care and ultimately enable aging in the right place. So some of these key initiatives include reablement services, home-based primary care, and community care navigators. So home and community-based care could be expanded to include preventative services, such as reablement services, which help older adults with physical or mental limitations adapt to their conditions by either learning or relearning skills needed to function in everyday life. By taking a restorative approach to care, reablement programs promote and optimize a person's functional independence. And so integrating these types of services into home care programs would help older adults age in their homes by optimizing their independence and ensuring that they can effectively manage both the acute and gradual declines in function that are common during the onset of frailty and old age. Home-based primary care interventions, which are designed to support homebound individuals with multiple chronic conditions, could also be integrated into home and community-based care programs. So these types of programs use integrated interprofessional primary care teams, which include geriatricians, nurse practitioners, physiotherapists, and general practitioners to provide the care homebound individuals need directly in their own homes. And they could be used to support older adults who cannot easily access office-based care. And finally, community care navigator roles modeled on the programs implemented in Japan and Taiwan could also be used to improve the coordination of services by identifying and managing the care journeys of older adults. And now in turning to interventions that support unpaid caregivers, making aging in the right place a reality for older Canadians will really depend on ensuring that we have essential policies and programs to support unpaid caregivers in Canada. So the NIA estimates that in 2019, based on an assumed hourly cost of $30 an hour, unpaid caregivers provided just under $9 billion in additional free care to Canada's publicly funded healthcare system. And as the number of older Canadians with chronic health conditions increases in the coming years, unpaid caregiver support will become an even more important factor. So while there are about 350,000 older Canadians requiring the support of unpaid caregivers today, that number is projected to more than double by 2050 to 770,000. And since data on the cost of unpaid caregiving was compiled in 2019, that data was compiled in 2019, the pandemic has only accelerated the cost of labor, meaning that unpaid caregivers have been saving the system even more. So the current cost of an hour of care may be $35, if not higher, and based on an hourly rate of $35, the 2019 value of unpaid caregiving for home care supports older Canadians are being provided for free by their family members in today's dollars is approximately $10 billion, with a projected future value of about $30 billion by 2050. But while unpaid caregiving saves Canada's healthcare systems billions of dollars annually, this support has unfortunately come at a considerable cost to caregivers themselves. So unfortunately, unpaid caregivers often face an enormous toll on their personal health, well-being, and finances, including lost wages, lower retirement income, and caregiver burden and distress. So better caregiver supports and interventions are needed to mitigate these consequences. Among them is the need for better financial support, with existing evidence showing that when adequate financial supports are available for unpaid caregivers, they can significantly protect against both caregiver distress and the resulting long-term care home admissions among older adults. There's also a need for more non-financial interventions, such as caregiver education and training, as well as access to more supports to decrease caregiver burden, such as home care, respite care, and adult day programs. And so now turning to the third pillar of the NIA's Aging in the Right Place framework, which focuses on developing more accessible and safer living environments. So the environments in which older Canadians live and engage need to be designed to better accommodate and address the physical and cognitive limitations that often lead to unnecessary institutionalization in old age. And so this pillar really focuses on two intervention areas that are critical to enabling aging in the right place, which are providing safe and accessible and supportive housing and well-designed and accessible transportation services. And so ensuring older Canadians have access to adequate housing is critical to enabling aging in the right place, given that currently many older Canadians are without adequate housing to support their needs as they age. So for example, a recent report by SE Health on behalf of the Canadian Mortgage and Housing Corporation estimated that 65% of older Canadians are in what they call the missing middle of housing options, meaning they have few or no housing options that meet their financial, medical, functional, and personal preferences and needs. In addition, there is also a need for more accessible housing, as it is well documented in existing research that the accessibility of an older person's home environment impacts their ability to remain there as they get older. So when housing is inaccessible, it creates safety hazards and leads to things such as falls, and which have the consequence of sending older adults into long-term care homes who might not otherwise have ended up there. And so older adults also need to continue having access to transportation services to ensure that they can continue accessing other essential services and maintaining active roles within their communities as they age. So older Canadians use transportation services for several reasons, most commonly for reaching appointments and visiting with family and friends. And because the average older person stops driving about 10 years before they die, they must rely on others to drive them or have access to other practical ways of getting around their communities. And so ensuring that older Canadians have access to inclusive transportation systems that accommodate the needs and preferences of older adults is also a key factor to enabling aging in the right place. So when thinking about key initiatives that can help promote more accessible and safer living environments and ultimately support older Canadians to age in the right place, innovative housing models and infrastructure that support their independence, safety, health, and social well-being are really what's key. And one of the innovative housing models that we focus on in the report are naturally occurring retirement community programs, or otherwise often referred to as NORCs. So NORCs are communities that over time come to house a large proportion of older adults. And while they don't have a consistently agreed upon definition or parameters, they usually do exclude communities that have been purposely built for older adults, such as long-term care or retirement homes. And NORCs have been used to support the delivery of programs that integrate health, social, and physical services, often with the goal of supporting older adults to age in place. And a key aspect of NORC programs is that they tend to include intentional opportunities for older adults to inform what types of programs and services are needed within the community. And so since launching our series on aging in the right place, we have now published a subsequent report specifically focusing on NORCs, which is also available on the NIA's website and can be shared afterwards. And so other housing models that are further covered in our Aging in the Right Place report and that could be used to support further additional aging in the right place in the future include home sharing and co-housing. And then in terms of initiatives that can make transportation services more accessible to older Canadians, improving rural transportation supports is definitely one that really stands out when thinking about being able to support many older Canadians to age in the right place. Other initiatives include providing older adults with free public transit and targeted outreach and education in the form of transit training programs for older adults that raise awareness about existing transportation services or that educate them about how to transition to other forms of transportation following the loss of their driver's license. And now I'm going to be moving on to the last pillar of the NIA's Aging in the Right Place framework, which focuses on improving social connections to reduce loneliness and social isolation. So ensuring that older adults can maintain relationships and social connections as they age is also critical to enabling aging in the right place. And that's because older adults are often vulnerable to diminishing social networks and less frequent social interactions as they age, given that the aging process is often characterized by transitional life events such as retirement, widowhood, death of friends, and relocation, and these can lead to social isolation and feelings of loneliness. Research has also consistently shown that both social isolation and loneliness are associated with a number of negative health behaviors, including a lack of physical activity, smoking, drinking, and a range of adverse health outcomes, including cardiovascular disease, dementia, mood disorders, depression, and cognitive decline. But perhaps most concerning is the fact that both social isolation and loneliness have been identified as significant independent predictors of premature mortality. In fact, one prominent analysis found that the health effects of prolonged social isolation are equivalent to smoking 15 cigarettes a day or excessive alcohol consumption. And although there are a few studies in the Canadian context, social isolation and loneliness have been determined to be key predictors of long-term care home admissions as well. But when thinking about the extent of the problem, current estimates of social isolation and loneliness in Canada vary widely due in part to varying definitions and measurement challenges. However, the NIA's recent Aging in Canada survey found that over 40% of community dwelling Canadians aged 50 years and older are at risk of social isolation. And then in terms of the prevalence of loneliness, estimates suggest that they could range from anywhere to 10 to 50% among community dwelling older Canadians. So on top of the significant implications of social isolation and loneliness for health and well-being, the COVID-19 pandemic has only exacerbated issues of loneliness and social isolation among older Canadians. And so when thinking about key initiatives that can help prevent and address social isolation and loneliness, one type of intervention that could be very useful in promoting aging in the right place are preventative home visits, such as those that are available to older adults in Denmark, where all citizens aged 80 years and older, as well as those aged 65 years and older who are considered to be socially vulnerable, receive annual preventative visits. So the purpose of these visits is to identify the need for assistance, prompt productive discussions about well-being and current life circumstances, and offer guidance about health and supportive services and activities that can help older adults maintain their social resources and functional capabilities. And health and social programming interventions could also be useful, such as social prescribing programs in which prescriptions are written for non-pharmacologic interventions, such as engaging in social activities or exercise. And so in addition to outlining its framework on key factors that enable aging in the right place, in its report, the NIA also conducted a rapid review of available existing programs and services across the 4 pillars to provide an overview of how well Canadian governments are supporting older Canadians to age in the right place. So this rapid review provides a high-level overview of how jurisdictions across Canada are addressing the four pillars based on publicly available information. And while it is not meant to be a definitive resource or comprehensive or systematic, it does serve as a useful indication of how well governments are doing in supporting their older populations to age in the right place. And we also hope that it can serve as a useful resource for older adults and their loved ones looking to identify potential programs or services that they can draw on to better support themselves as they look to age in their homes and communities. And the full list of programs that we identified can be found in the full report. But today, I just want to quickly provide a high-level overview of some of the trends that we identified during our review, with the first being the limited availability of programs and services based on location. So many programs that we looked for were only offered in certain areas or regions, often very highly populated urban centers. In addition, across all 4 pillars, there was routinely fewer programs available in the territories, with none of it especially lacking some of the key services and programs that we looked for. On the other hand, Alberta, British Columbia, and Ontario were found to offer many programs across the 4 pillars that can support aging in the right place. And finally, when looking at the specific types of programs that we looked for, we also found that there were some shortages in the availability of fall prevention and reablement programs in particular. And finally, to wrap up the report, we developed 10 policy recommendations to provide policy and decision makers with pragmatic solutions to better address the gaps identified through our review and more effectively support aging in the right place policies and practices across Canada. So by working to implement these suggested changes, we think that governments can give all Canadians a better chance to age in the right place, and this would greatly improve their quality of lives while addressing long-standing systemic issues within Canada's long-term care system. And so the 10 recommendations can be found in our report. Here is a quick summary of what they are, but really the main ones that I'd like to focus on today was, the deliberate public policy response to shift long-term care resources towards home and community-based care service is a very important one. The implementation of community care navigator roles could really have a huge effect as well. And then screening solutions for social isolation and loneliness are especially critical, given that we know that both of these things can have such detrimental effects, but are really easily addressed if we can just pinpoint them. And so that wraps up my webinar, and thank you all very much for joining us today.
Great. Thank you so much, Natalie. That was extremely informative and went through all the, the pillars and quite extensively to give a really good understanding of the report and why this is so important. I do have a few questions that I want from our audience who are participating today. One was, in your opinion, in regards to the findings, is the funding model for community home support or Meals on Wheels, transportation, that kind of thing, a barrier for people wanting to age in place in their home? Currently, the funding model is such that community support service agencies are required to charge a user fee for services such as fundraising to support these programs.
So I definitely think that acts as a barrier. The funding model, addressed there specifically, but the broader way, going back to the message of how we allocate funding to community care right now is a huge barrier. And that is one of the things that we are hoping to convince governments of and the general public, so that we can advocate on behalf of older Canadians that really we should be allocating more of our long-term care spending towards home and community-based programs that includes things such as Meals on Wheels and meal preparation programs.
Great. So I guess I know some people have just wrote in about, that advocacy to politicians, to the, premier was mentioned once. So that is currently taking place then?
Pardon me?
So some of that advocacy in terms of moving the agenda forward is taking place?
Yeah, so that is the goal of what we do at the NIA. So a lot of research focus, but we try to make our research accessible and digestible to the general public so that we can have others kind of hop on the bandwagon and also help. But really our goal always remains to be advocating on behalf of older Canadians. And so through reports like this, we hope to spread the message, get involved how we can, have others get involved so that we can really try and convince the government that these changes need to happen and they need to happen quickly.
Great. So there's another question. Are there already implemented projects in Ontario that tends to achieve the results of the 4 pillars that might enable aging to live in the right place? And if yes, we appreciate if we could have access to one or more of these projects. So are there projects sort of going on in regards to these pillars that you've talked about?
So we don't have projects that have specifically implemented the pillars that we have outlined, but I will say that in doing our rapid review of programs and services related to the 4 pillars, Ontario did perform better than many other regions in Canada. But again, we suspect that's likely due to the fact that Ontario is a much larger province relative to some others. So again, that goes back to how programs are often available based on location. And so while Ontario does do a pretty good job when compared to the rest of Canada, there is a ton of room for improvement. And so we don't have programs specifically looking at the 4 pillars as a whole, but it would be wonderful if we could get there one day and try and implement something where we really focus target efforts on all 4 pillars and we can examine how effective they are over the future.
Yes, I know there's been lots of discussion around the NORC aging that, and I know some people have been talking about that. So maybe that's sort of one of the issues that the pillars that people may be thinking about, because there has been some discussion in communities to implement
Absolutely.
that. The other question, the information shared today is realized by community sector and Canadian government. Supporting caregivers financially is a positive incentive. The HR shortage in both healthcare and long-term care sectors has a direct and critical impact on this concept, aging in place. How can we better support this community plan? And I guess I just, when you're talking about, and that was one of the questions I wrote down, I was like, you're doing your advocacy, but how can we engage the community to support your efforts? And so we're all sort of having that united voice forward.
I really think that when it comes to unpaid caregivers, like the average Canadian and most Canadians know that they play an important role, but I just don't think the public understands the magnitude of what they're providing to our healthcare system. So like when you quantify the numbers, the way that some of the NI estimates were able to, like these billions of dollars saved annually is really just kind of mind blowing. And I think if more people in the public were aware of that, there would be a greater understanding and push for why we really do need to be supporting this group of individuals, because without them, the system doesn't work.
And somebody was just asking, what is a community care navigator? And does this role require specific skills and the knowledge?
Yeah, so community care navigators help kind of coordinate the overall plan of care for older adults. So we discuss it in more detail in our report, but in terms of whether they need specific qualifications, I'm not sure, but I can look into that and pass that information back along to the group.
Great. Do you examine any programs where the end user directs the funds? We feel this is a key issue to allowing seniors to age where appropriate.
No, we have not examined that, but that is something I will take note of and bring back to the team as something we should consider for next steps.
Yeah, I know that had a long time ago, there was some discussion of giving people money to figure out where they wanted to sort of allocate that in terms of their aging in place.
Yeah.
Where can people access research models of best practices for encouraging municipal governments to encourage seniors to move to a community?
So that's a great question. And so municipal governments are one that we actually did not focus on in this report, just given the scope. And, you know, because we are national focus, we take a national focus, and we did want to focus on Canada. Looking at municipalities individually across Canada would have delayed us being able to launch this. But I do think that some municipalities are doing a very good job of supporting aging in the right place. And so that is another element that adds context to this whole narrative, is the fact that how these services are provided really gets redistributed from both all the way to federal level, all the way to the municipal level. And so, you know, some municipalities are doing a much better job, but in terms of where we can access those, that is actually something the research team struggled with, and we are still looking into ourselves.
Okay. There was also a question just building on the community piece. So do we know if the pillars are accepted and approved, and will the community care centers be rolling out services to the community as funding becomes available from the province?
So in terms of, I'm not sure what is meant exactly by accepted and approved. So this is our suggested framework and set of 4 pillars based on, you know, an extensive review of the research and, you know, all the factors that do contribute to long-term care admissions, but that also can be effective in preventing them. But again, because it's early stages, you know, ideally we can get this message out there and have more people look into the pillars, do additional research on them, and then see where we can take it from there.
Okay, and then there was just one sort of a comment kind of question around long-term care connections. Adequate and sustainable funding for long-term care homes seems incompatible to the recommendations for shifting long-term care resources to home and community care. You just asked, maybe comment on that?
Oh yeah, absolutely. So I think the general concept is that like home and community-based care is part of long-term care. So when we say shifting spending we mean shifting spending away from institutions such as nursing homes that provide long-term care, so that we spend more of our long-term care budget on home and community-based care. So right now, Canada spends about 60% of its long-term care expenses on institutions, whereas most OECD countries have a more even 50-50 split. And so, you know, if we redistributed those resources, we could still have nursing homes and long-term care homes available, but it's just about allocating some of that funding towards home and community-based care that also is much more cost effective, and you get a better bang for your buck with every dollar spent.
Great. And just one sort of last question, going back to that sort of advocacy role, because we're just a little bit over time, was how much power or influence does NIA have in sort of making some of these changes? You know, I know you've got a lot of key researchers and geriatricians and people working at NIA. So maybe you can make a comment on that.
Oh yeah, absolutely. So, you know, our team is very diverse and well-versed in the space, but we are a research institute primarily that does focus on advocacy, but yeah, as you mentioned, so, the director of health policy is a geriatrician who works with seniors in hospitals, and he recently led the development of long-term care standards in Canada. So we do play a very active role in advocating for older adults. There's a lot of media pickup and traction that we have related to a lot of our research and spreading the message. And, it's kind of chipping away one step at a time in that sense that we can convince politicians to listen to us and implement some of the changes that we suggest.
Great. Thank you so much for all your questions. And I know many people have lots of great comments about how wonderful the presentation is and insightful from all the, making a change moving forward with our population aging and doing things differently. So hopefully people have a chance to look at that report more fulsome, have a chance to night reading, look at it more and get engaged on your website. There's lots of ways to get involved. So check that out as well. For those, just as a follow-up, for people who want to reach out for support, they can call our organization or the senior support line for some help and information and referral, which is run through the Assaulted Women's Helpline. Just to let everybody know, we are actually hosting a conference next week into assessment tools and interventions for around elder abuse. We have a huge lineup of speakers, both internationally and local, regional, that we're really looking forward to. So have a check on our website and look at that and maybe register. And you can use this QR code if you have your little cameras handy, just to go to the website as well. We have over, I think, 300 and some people already registered. So we are looking forward to that event. We also are having another webinar this Friday looking at ageism. And I know that Natalie had mentioned that in her report and how that has affected individuals, talking about social isolation. That also will be discussed at this webinar. So if you haven't had a chance already to sign up for that, you can look at our website and under upcoming webinars and register for that as well. And then lastly, that reminder about our evaluation. I will send out a reminder, but again, here's a QR code. If anybody is interested in participating that way, you can take your camera on your phone and scan the code and it will come up, Survey Monkey. You click that and it should take you right to the survey. And lastly, if you want to contact our agency, there's my contact information, our website. We're very active on social media. So please take a chance to look at that and contact us if you need to. Thank you all for participating. Thank you for our ASL today to join us to provide their services. And stay tuned, and we look forward to everyone's further participation at other coming events. Thank you very much, Natalie, and have a good day, everybody.
Thank you so much, everyone.